Essentially, this is a fairly new technique whereby the surgery for bunions is now performed through 3 very small incisions, each of about 2 to 3 millimeters long, as opposed to the previous traditional surgery where 2 incisions of 1 and 5 centimeters were made, and hence it's more cosmetically acceptable, but more importantly there's a lot less soft tissue stripping and pain. We make the 3 small incisions under X-ray TV for accuracy. We then pass through one of the incisions a small burr, which is a small cross between a drill and a saw, and cut the bone across the neck of the metatarsal, and then push it into the foot to narrow the forefoot. And through the second incision we pass 2 small screws, again under X-ray TV, to hold the cut bone in the correct position. Through the third incision we release a tight ligament and tendon, which completes the correction. The procedure would typically take about 35 to 40 minutes. It can be done under local anaesthetic or general anaesthetic. We feel that general is better, but being such a short procedure and so relatively painless, it's almost always performed as a day case procedure, apart from perhaps in the older patient or when we operate on both feet at the same time. It's beneficial for young people who want to return quickly to sporting activity. It's also beneficial in diabetics who tolerate wound stripping and soft tissue stripping less, and also in rheumatoid people for the same reason. It's also better for pretty much anybody at any age really, as it's a lot less painful and you heal from it more quickly. The pain after bunion surgery is a bit of a myth anyway, because we use local anaesthetic blocks, and the newer techniques using fixation with screws mean that the bunion surgery is a lot less painful than it used to be in previous less rigorous techniques. But this procedure is even less painful than the recent more standard techniques. Weight bearing is allowed from day 1. The patient's given a post-operative sandal, which is a firm-soled flat sandal with Velcro straps on the top. You can wear that and you can walk little and often, perhaps 15 minutes in one go, but it's most important to keep the foot up at rest when you're not walking in order to allow the wounds to heal without any swelling. The main problem with this surgery is it is limited to the mild to moderate bunion deformity. You shouldn't try and operate on someone with a severe deformity, as this technique is literally not powerful enough to get enough correction of a more severe deformity, and one has to go back to the more standard open techniques. Side effects are of course possible in any operation. The general ones to any foot and ankle operation are infection, injury to some of the small nerves that run to the toes leading to numbness, and possibly, although thankfully rarely, DVT or blood clot in the leg. We give medication to try and mitigate against those risks. The more specific risks of this operation are very rarely a screw can back out, or sometimes under correction if the technique is not strong enough for the deformity. In other words, bad choice of technique for the patient. If the bunion is corrected properly and sufficiently, it should be a lifelong correction without recurrence. No, this is fairly unusual. It's not unique to me, but it's probably performed in about 15 centres across the country, and is still very much in its infancy, as opposed to being very commonly used across the country. You can find out more on the London Orthopaedic Clinic website, or sometimes, if you wish, via the Princess Grace website also.
So what are the benefits of this type of treatment?
The benefits are much less pain, much less swelling and bruising, a good cosmetic result in terms of the scars, and quicker recovery.
Okay. What happens during the procedure? How long is the procedure?
The procedure typically takes between 30 and 40 minutes, depending on complexity, and it can be done under either general or local anaesthetic. The procedure is usually a day case if one foot is operated on, but if 2 feet are operated on at the same time, which is quite possible, then you might wish to stay in for one night, or if the patient is elderly, a one-night stay will be applicable.
Is it beneficial for anyone in particular?
It's particularly good for young people who wish to get back to sporting activity quickly, and also it's beneficial for diabetics and for rheumatoids who tolerate excessive wound stripping much less than otherwise in terms of wound healing.
Is it going to be painful after?
Pain from bunion surgery is something of a myth, largely because of the newer standardised techniques, and also we use very good local anaesthetic blocks around the ankle to keep the pain down. When the local anaesthetic block wears off, hopefully 24 hours later, most of the post-operative pain has passed anyway, and minor painkillers are needed as opposed to heavy-duty treatment. Pain is not a big feature of any bunion surgery these days, but particularly with the minimal soft tissue stripping for this procedure.
And when will I be able to wait there? Is there anyone who shouldn't have this type of surgery?
The only significant contraindication to this surgery is in someone who has a bunion deformity that is too large for the limitation of the surgery. In other words, this operation is good for mild to moderate bunion deformities. For the bigger, more severe bunion deformity, clearly the more standardised open techniques are more appropriate to get as more correction is needed.
Are there any possible side effects? And how long does the treatment last?
All things being equal, if the bunion is corrected adequately or satisfactorily in the first instance, there should be no recurrence of deformity and the patient should have a straight toe lifelong.
So does every orthopaedic surgeon offer this treatment?
No, this is quite rare throughout Britain. It's more common on the continent, particularly in France, and it's not really caught on in the States at all. It is only offered in about 5 centres in Britain at this stage.
Great. And where can I find out more?
You can find out more about this technique on the London Orthopaedic Clinic website or on the Princess Grace Hospital website.